What is up, y'all? Welcome back to another video. Today I wanted to talk a little bit more about hip dysplasia. So let's talk about hips, baby. Let's talk about my right and lefty. Let's talk about all the things that led to my surgeries. Let's talk about hips. Let's talk about hips. All right, so real quick before we get into the whole background of what hip dysplasia is, I just wanted to give you a quick story about what happened with me. At the age of 28, I was diagnosed with severe bilateral congenital hip dysplasia, and how I found out was through an x-ray because I was having pain walking. So my doctor at the time did not prescribe me physical therapy. He just told me to take some over-the-counter meds like Tylenol and ibuprofen and told me to work out more. Real quick, y'all, I forgot to mention, at the age of 28, the doctor that I seen at the time did want me to do a total hip replacement, but because I was hesitant and scared, I said no to the surgery, which is why he gave me the options that he gave me. So, yes. At 28, I was diagnosed with severe bilateral congenital hip dysplasia and told me the only treatment option for me was a total hip replacement. But again, I didn't want to do that. So that's why I went the route that I did. So from the age of 28 to 37, I was working out and taking OTC meds until I had a gym injury and tore my labrums bilaterally. At 37 was when I finally decided to see my current doctor, who then prescribed cortisone shots. So for many, many years, I did cortisone shots. I tried physical therapy until those cortisone shots no longer worked for me. And I was still trying to delay the surgery. So I tried doing yoga. I tried massage therapy, ice therapy, heat therapy, trigger point therapy. I even became a vegan to try and stop the inflammation. And nothing worked because, again, severe bilateral hip dysplasia. I had absolutely no socket, which led to advanced osteoarthritis. So I was in complete debilitating pain by the age of 42. And that was when I decided to do my surgeries. So without further ado, let's get into what hip dysplasia is. Bye, y'all. Disclaimer alert, I am not a doctor. This is just information provided to me from my doctor and information that I researched on my own. So it's always best to check with your doctor if you have any questions. This is just for educational purposes and for insight into my life. All right, let's get into it. So what is hip dysplasia? Hip dysplasia is a deformity of your hip joints. Basically, your socket and your thigh bone aren't fitting properly together. Now this can affect one hip or it can affect both hips, which in my case, I was affected in both hips. What are the symptoms of hip dysplasia? Well, most people don't know they have hip dysplasia until they start experiencing pain. That pain can lead to a limp, or in my case, I was waddling because both of my hips were affected. You could have other injuries such as labral tears. You may hear some clicking or popping in your hip. You may be dislocating your hip. Every case is different. So depending on the severity of your dysplasia and depending on the person, all symptoms are different. And last but not least, in severe cases, advanced osteoarthritis. How are you diagnosed? Typically, people are diagnosed through x-ray. A doctor will order an x-ray and then may do a physical examination on you where he's maneuvering your legs or your hips in a way to figure out what's going on with them. In other cases, if you have some other injuries such as labral tears, they may do an MRI or a CT. In my case, I was just diagnosed through x-ray. What are the treatments for hip dysplasia? Well, depending again on the severity of the dysplasia, you may just be prescribed over-the-counter pain meds, physical therapy. Eventually, it may lead to cortisone shots, the surgeries. Those are the last two. So there's two surgeries depending on, again, how severe your dysplasia is. Most people who are younger with a milder case of hip dysplasia can do a surgery called PAO, or periacetabular osteotomy, which basically it's a surgery where they preserve your hips and they make multiple cuts within your pelvic bone, reposition it so that way your socket and your thigh bone is fitting properly together. Once they get that perfect fit, they'll screw everything back in, and you are spending a lot of time of recovering. I personally don't think I would have been able to handle that surgery after knowing a little bit more. My dysplasia was so severe that I was not a candidate for it. And so your last option or treatment would be a total hip replacement. It's always best to check with your doctor to see what treatment is best for you. What happens if hip dysplasia is left untreated? Debilitating pain, loss of function. I mean, I've got to that point where I feel like I waited too long, but you know, things happen the way they should. So if hip dysplasia is left untreated, eventually you will lose the ability to walk. You will have such severe pain and extreme advanced osteoarthritis. I don't know if there's extreme advanced, but let's just say osteoarthritis. So don't wait too long. Always check with your doctor. Take care of your body because it is the only one you will have.